Again, to paraphrase him, he said, you're taking skin cells from patients that have specific brain disorders, then doing some mumbo jumbo to the cells to push them back in time and turn them into stem cells. And then he knew that stem cells can be coaxed to become any cell type. So then you're taking them and turning them into brain cells that form brain circuits. That's right. We can build human brain circuits in a dish. How is that possible? Building on the hard work of biologists over the past 15 years or so, we can today take any cell type from any individual and then push it back in time to turn them into stem cells and then guide those stem cells to become any other cell type. We start by asking a patient to provide a small skin sample. We then take those skin cells, reprogram them by putting a series of genetic factors, and push them back in time so that those skin cells become stem cells. It's like cellular alchemy. These stem cells have almost magical abilities to turn into any other cell type. So what do? We take these stem cells, we dissociate them, we then aggregate them so that they form spheres or tiny balls of cells. We then take those, move them into a special plate where there is a kind of chemical soup. And that chemical soup will allow them to grow and transform and turn into a brain organoid. By providing different cues, we can turn these brain organoids to resemble specific regions of the central nervous system. For instance, we have a recipe that allows them to become a cerebral cortex, the outer layer of the brain. By using a slightly different combination of factors, we can turn them into a spinal cord. The secret to this process is careful guidance. In the end, they look like this: tiny clusters of brain cells at the bottom of a dish. And let me be clear, these are not brains in a jar. These are parts of the nervous system in a laboratory dish. Each of them contains millions of cells, and we can even listen as they fire electrical signals. Or we can watch them as they sparkle with electrical activity. Or we can image inside and watch the cells as they communicate with each other. Isn't it remarkable to think that just a few months ago, these cells were skin cells in a patient, and now they're neural cells at the bottom of a dish that we can study at ease? Thank you. So with these models of brain growth, we started wondering, could we use them to start to understand disease? So, for instance, we wanted to know, could we understand